Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about degree, diploma, or certification in medical coding. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. A lot of people ask me, well Blue, I got my diploma in medical billing and coding. Is this enough to get a job? Or Blue, do I need a degree like an associate's or a bachelor's to get a job as a medical coder? Or should I just get a certification? Which way should I go? All right, so it depends on what you want to do. But I will say this first. If your school is giving you a diploma for finishing your medical billing and coding program, this is not the same as getting a certification. A certification is one that is, you have to take a test, but it is issued through the American Health Information Management Association or the American Academy of Professional Coders. Either one of these is who you want to be certified through. If the program is preparing you for a certification that is not with AHIMA or AAPC, then I strongly suggest that you consider going someplace else. And if you say to me, well, Blue, this one is cheaper, I can get started. If no employer is looking for that credential, it is generally a waste of money, right? Because why would you sit for something and no employer is looking for it, all right? Your money is better served with something like AHIMA or AAPC, which employers are looking for if you are wanting to become a medical coder. Now, some employers will tell you, if you have finished a formal program, that is fine. You have your certificate for completing a program, but we are still going to expect you to be certified as a medical coder either within 6 months, sometimes up to a year, sometimes 2 years, depending on the employer. So it really all depends. And as far as if you should get certified or go through a college program, now, the college programs are for people who are wanting to be our leaders in this industry. You know, the RHIT, or the Registered Health Information Technician, and the RHIA is the Registered Health Information Administrator, are our leaders. They are meant to lead the flock, okay? So the RHITs, they're more of the hands-on worker bee. They are going to be your auditors. They are going to be the people that are going to be boots on the ground, really taking care of the medical coders. Sometimes they serve as a lead medical coder because of their training. They have the degree programs, again, are going to have an emphasis on the human resources part of this field. So, and the management side of this field. So that is something to keep in mind. If you are not wanting to do that, then obviously you may not want to do the RHIA program, because the RHIA program is going to be the captain of the ship. They are the one that is going to be at the forefront, and they are going to be the head of the department. They're going to be in that executive suite. They are going to be the face of the department. And so a lot of the training that they have, again, is on that managerial side. They are not going to be doing medical coding on the day-to-day. So if you are interested in just medical coding, it is better definitely to go through a medical coding certification program and then sit for either AHIMA or AAPC credentials. The ones that are the most popular, of course, the CCS, the gold standard of medical coding credentials, the CCA, which is the entry level, but still a very powerful credential, the CCSP, which is the mastery of the outpatient setting. These are all with AHIMA. With AAPC, there is the CPC, the Certified Professional Coder, and there's also the CIC, the Certified Inpatient Coder. So those are the ones that employers will look for. And when they're looking for these folks, people who have certifications, now they're the ones that are, you know, doing the coding. Sometimes people have told me, well, no, my hospital only looks for degree holders. That is not true, because when you're looking at the job listing, it will say candidate must be RHIA, RHIT, CCS, CCSP, a CCA, or even a CPC. So there is a wide variety. I'm not saying that they don't look for those. Obviously, if they have their would rathers, you know, they're going to look for somebody who's been through a formal program. But having a degree does not guarantee that you know how to code, because again, that is not the emphasis of those programs. Those programs have a strong emphasis on the leadership side. So sometimes employers will require the degree holders to have a credential in conjunction with, so that they can show their medical coding proficiency. To be an effective leader when you are having those degrees, you're often going to be called on to be the neutral voice when there is a disagreement between the auditor and the coder. So you're going to be the one to settle those arguments. And if you don't know how to code, this could be a problem. So this is why they do require that a lot of times for their degree holders. Not all places, okay, but most will. So that is something that if you're considering going into the degree program, you're going to want to exercise the full use of that degree. Now, the degrees, while they are very awesome because you get to do a lot more, you have a lot more opportunities with those as far as like management or teaching or doing other things. You can do other things with those. But if you have your degrees and you're working as a coder, you're really kind of working under your potential, your full maximum potential. So that is what I tell people. You know, you can go through a certification program if you are just interested in doing medical coding. That is totally okay. But yes, if you are interested in that, by all means, go for the degree programs. If not, then go for the certifications. But keep in mind, if you only have a diploma, you don't have those credentials behind your name yet, you know, try to get focused on taking and passing your certification exam. Whether you sit for AHIMA or AAPC, it does not matter. People will ask me, well, Blue, which one is better? Either one. You know, employers look for either one. And there is no association that is better than the other one. I will never say that. I have known high quality, high caliber coders with both associations, and I've known bad medical coders with both associations. So that is the difference. You know, the caliber of every medical coder is different. This is why I tell my degree holders, when it is your time to do the hiring and you are looking at brand new medical coding candidates, that to really consider hiring somebody who is a CCA or who is a CPCA, because they have worked hard to get that certification, and they deserve a chance just as much as anybody else. Because you can have years of experience but not know anything, right? Especially if you have pigeonholed yourself into a single specialty and you don't know anything else and you don't want to learn anything else, but where you have been has been the easy clinics for you. That doesn't help you when you need to grow outside and go into a different type of clinic. So it really all depends. Don't limit yourself, folks. That is my advice on that. But yes, you know, if you're not sure where to start out with the certification, because you really can't go wrong. Don't invest thousands and thousands of dollars to get into a field that you have no idea what you're doing just yet, or even if you're going to like it. Because there are some people who will do that. They will spend $30,000 and $40,000 and $50,000 just trying to go into a program, and then find out that they're not getting that hands-on training, and they're not getting all that support that they were promised. And you know, it's not pretty. And sometimes they just drop out and they waste all of that money and they get caught up in that student loan. So don't let that happen to you, folks. Don't let that happen. And don't be taken advantage of. Do your research. And if you're asking me like, well, you know, which one should I go with? Either one. I've done the breakdown on the memberships for the different associations, and I will leave that link if I don't forget in the description box. And if I do forget, make sure that you comment, hey Blue, can you leave a link for that video? I will leave it in the description box of this video, but I did do a breakdown of the cost difference between getting certified with AHIMA and getting certified with AAPC. There is a huge cost difference maintaining one credential. And yes, friends, you only need one. You don't need to start out with a string of credentials. Having a string of credentials does not get you hired faster. It does not get you more money, especially if you don't have experience. The only time that you should really start to invest more in additional credentials is when you've had that experience, so that you do have something to back up all of those credentials. It's sad to me when I see brand new people, CPCAs with a slew of credentials, and all of those credentials can be tested on that same CPC exam. Risk adjustment, billing, All of those things are already all covered on that CPC exam, right? So those are the things that you really do need to think about. Now, before somebody says, oh, no, not risk adjustment, the diagnosis coding is still tested on the CPC exam. Okay, so that's what I'm saying. And I just want you guys to know, when you're getting into this thing, when you're getting into medical coding, there's going to be a lot of people trying to sell these things to you. You don't have to fall for every single one. Okay, guys? Hold on to your money, because at the end of the day, when you're in this field, you're in it for the long haul, right? Or hopefully you will be. And when you are, you do need to keep in mind, it's not just that single cost as soon as you get your certification. It is maintaining all of those credentials. It is maintaining your knowledge in this field. And that does cost money. So just keep that in mind. At least that's my fervent wish, that you all keep that in your mind when you're going through and you're trying to add on these additional credentials because somebody is telling you, oh yeah, you'll make more money. The way you make more money is by getting experience, by being willing to take on those harder clinics that nobody wants. That's how you start getting that experience so that you can move up. But you'll never get that if you're so concerned when you're down here, when you're learning about how much money you're getting right away. Okay. Of course, you want to work at a place that is paying you fairly. Every place is different. That's why I never talk about money and specifics on my channel. You can find that out in your local area. You can go to the Department of Labor or the Bureau of Statistics, and it will let you know what the starting salary is for a medical coder in your area. So I really do advise you guys to please look into that website. All right, so I'm going to go ahead and wrap this one up. I hope this was helpful. Thank you guys so much for joining me. Like, subscribe, share, and I will see y'all next time. Bye.